Hello and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. The United States donates an additional 3.2 million Pfizer COVID-19 vaccine with longer shelf life. Livelihoods have not improved since pandemic hit, says business owners in Jigawa State as they ask for government support. And British Prime Minister Boris Johnson announces end of the COVID-19 measures in hope that the worst of Omicron is over. Thank you for joining us. WHO Africa region reports that there are over 10.4 million confirmed COVID-19 cases on the African continent, with more than 9.3 million recoveries and over 234,000 deaths cumulatively. Now, the organization has also warned that the COVID-19 pandemic is far from over, as France, Germany and Brazil posted new records of infections in the past 24 hours. The highly transmissible Omicron strain has spread unabated around the world, pushing some governments to impose fresh measures while speeding up the rollout of vaccine booster shots. Europe is at the epicenter of alarming new outbreaks, with Germany's cases soaring past 100,000. France is reporting nearly 500,000 cases yesterday. Well, here's more on the pandemic update.
163 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 12 states and the FCT. That's a drop from the figures reported earlier. Lagos accounted for the highest number of cases with 59 infections. The FCT had 33, Delta 16, Kaduna 13, while Gombe and Osun registered 12 cases each. Ogun, Ekiti, Oyo, Rivers, Borno, Imo and Nasarawa states logged a single-digit infection. The total confirmed cases in Nigeria now stand at 251,341. The report also includes a backlog of confirmed cases from Borno, a backlog of discharges and deaths from the FCT, as well as 0 cases from Bauchi, Plateau and Sokoto states. 310 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 224,939. There were 6 additional deaths recorded in the last 24 hours, raising the fatality toll to 3,116. Currently, there are over 23,000 active cases in Nigeria, while more than 3.9 million samples have been tested so far. Lagos State accounts for the highest number of cases on admission, with over 17,000 positive samples, followed by the FCT and Oyo State. Almost 13 million of eligible Nigerians targeted for COVID-19 vaccination have received their first dose, while over 5 million of the population have been fully vaccinated. The total global confirmed cases have surpassed 334 million, while deaths are beyond 5.5 million.
And Nigeria has received 3.2 million Pfizer COVID-19 vaccine donated by the United States government as authorities step up efforts to curb the spread of the disease in the country. The executive director of the National Primary Healthcare Development Agency, Dr. Faisal Shuaib, and his technical staff, among others, took delivery of the vaccines presented by the U.S. Ambassador Mary Beth Leonard on Tuesday at the National Strategic Warehouse, Abuja. According to a statement from the U.S. mission, Nigeria, the vaccines have over 6 months of validity before expiration. The latest shipment reflects the United States' commitment to purchase and donate 1.2 billion COVID-19 vaccine doses worldwide. To date, the United States has delivered more than 370 million vaccine doses to over 110 countries. This includes the over 24.7 million doses of COVID-19 vaccines from the U.S. to Nigeria. And businesses are yet to fully recover since the outbreak of the coronavirus in Jigawa State, northwest Nigeria. Secretary to the Association of Small Enterprises disclosed this while speaking to our correspondent Sadiq Iliasu in Dutse, the state capital. Now, on the plight of traders, he spoke on the plight of traders and also the need for more government support. We'll bring you that report shortly. Well, the Director General of NAFDAC, Professor Mojisola Adeyeye, has been speaking on the process to approve a herbal remedy for use as a cure for COVID-19. She was speaking in an exclusive interview with Channels Television. According to her, herbal remedies must be subjected to globally accepted methods of evaluation to be accepted as standard cures.
You have to compare that herbal with a standard treatment, meaning maybe two sets of patients. You give one the standard treatment and you give one this herbal product, and you monitor them. When you are going to monitor, you have to use some indices. Is it a viral load? How many viruses you can find? Is it this? Is that? So you use some indices that you can monitor with time. For COVID, for example, the viral load should be decreasing. So that is clinical trial or efficacy study. When this will have been done, after, of course, when we will have approved the protocol, the applicant will bring the results to us. And we will make sure that international best practices were observed, the data is robust scientifically. NAFDAC will have gone to the clinical trial site to know that the environment where the patients are being treated or given this for clinical trial, that the environment is good, that the people that are doing it are qualified. All these things we have to have in our record.
Well, we have joining us for more on Herbal Solutions to COVID-19, Dr. Chidozie Okoye. He's a pharmacist, legal practitioner, also a certified counselor and homeopathic physician. Thank you for joining us on the program.
Thank you. Thank you.
Perhaps another day I'll pick up how indeed you were able to successfully get all of those titles. But then, we're talking on the issue of COVID-19 and then Herbal Solutions. But I'd first like you to talk a little bit about homeopathy. If someone is just hearing this for the first time, the pseudo-scientific system of alternative medicine.
Madam, come again?
I'd like you to talk a little bit about homeopathy, which you practice.
Okay, yeah. Alternative medicine, of course, is the opposite of conventional medicine. So we have traditional, complementary, and alternative medicine. Traditional medicines are the herbals, while complementary medicines are the ones that you can use with the conventional medicines. Alternative medicines are the ones you can use in place of the conventional medicines. And these can really play a critical role in the fight against the COVID-19 pandemic. Of course, they have been
traditional medicine.
Traditional medicine, traditional, complementary, and alternative medicine, all of them go together right now. There are a lot of remedies that have been developed by several researchers. Some of them have been submitted to NAFDAC. Some are still yet to be submitted. And of course, the federal government is really interested in development of homegrown solutions to tackle this COVID-19 pandemic. So a lot has been done from Plateau, from Edo State, from Lagos, from East here. So for homeopathy, there are a lot of remedies that can be used to manage the symptoms of COVID. They act as immune boosters, And it may interest you to know that the federal government has set up an expert committee for evaluation of the protocol, for evaluation of natural remedies, herbal remedies, and then complementary and alternative remedies. So we should explore them. They are homegrown. We cannot always be relying on our international partners to come to our aid. So that is my own position on that.
And also, we heard the NAFDAC professor, DG, talk about how perhaps COVID has also given Africa an opportunity to really explore as much as possible herbal solutions, not just to combating COVID-19, other viruses and other diseases as well. But in terms of what you've seen, in terms of, the listing, I mean, she said that some people were giving listing, that it also goes beyond that. There would have to be clinical, they have to pass the second approval, which is the clinical stage. Why do you think some of these herbal suggestions, propositions haven't met up to the criteria, and so that, it can be widely used as a drug or solution?
Yeah, the truth is that clinical trials are expensive to run. In the light of this pandemic, if the government is serious about developing homegrown solutions, then the government should provide funding for some of these research institutes to carry out clinical trials on our homegrown remedies. The individual researchers can hardly do it. The universities, some of them cannot afford it. The government should step in, either through the National Institute for Pharmaceutical Research and Development or through the Nigerian Medical Research. Even NAFDAC itself. NAFDAC can sponsor, if the government assists it and gives it funding, it can sponsor some of these clinical trials. There are many remedies that have been sent to NAFDAC for listing, but NAFDAC will always tell you, okay, for cure, it's for managing maybe the symptoms of COVID-19. So I send it back to the government to do the needful, provide funding. Sincerely, if it is done, we will see that there are a lot of herbal remedies, a lot of alternative remedies that can be used to manage COVID-19. And the pharmacists are ready. They're ready to partner with the government. The NIPRID is there. The Pharmaceutical Society of Nigeria is there. The Association of Community Pharmacists of Nigeria is there. All of them are ready to partner with the government. But the funding, because in the light of this pandemic, should be provided by the federal government. Thank
Dr. Courier, I want to also get your thoughts. In terms of the hopefuls, what exactly exists? And this is Herbal Solution to COVID-19. Some of the recommended solutions we've heard of include consumptions of raw onions, garlic, onions mixed with salt. We've heard so many things, the dogoyaro leaf, the Christmas melon. Tell us, in your opinion.
Yes, those things are foods that we have traditionally been eating in Nigeria and Africa. Most of them are immune boosters, boost immunity, and of course, you know that if your immunity is strong, you will not contract most of these viral infections and other bacterial infections. So it's good that people consume them. They help to boost immunity generally. And so we encourage it. Even the NCDC and the international health organizations, they encourage that people should eat food that will boost their immunity. But when you already catch the infection, then you have to follow the protocol for managing the infections. So we advise Nigerians to eat some of those vegetables, fruits, and other immune-boosting supplements that we have in Nigeria.
Finally, Dr. Okoye, is there still a long way to go for a herbal solution to COVID-19?
No, really. It's already here with us. is already here with us. You see, there are smallholder researches that have been done by different researchers, by different organizations, by different universities. There's a recent one from Alpha Babalola University where they developed some herbal remedies for managing the symptoms of COVID-19. And I read from the media that it has already been tested in the United States and found to be efficacious in managing the symptoms of COVID-19. There are a lot of other ones. There's one developed by an organization in Edo State. There's one developed by my friend, Professor Wanang, from Plateau State. There's one developed by Reverend Father Arazu. So there are a lot of them. Some have been sent to NAFDAC for listing, some still not yet listed. But the thing is that for the remedies to be said to cure COVID-19, according to the NAFDAC DG, they have to go through clinical trials. And so the remedies are here. It's now left for the government to do the needful, providing funding, let us go through these clinical trials, and finally certify that whether they can cure or not cure COVID-19. So
Hopefully, Dr. Chidozie, you can join us again. I wish we had more time and join the conversation. Thanks a lot. He is a pharmacist, a legal practitioner, also a certified counselor and homeopathic physician. Thank you so much, Dr. Okoye, for joining us on the program.
Thank you.
Well, we have more on the COVID-19 updates when we return. Please stay with us. Welcome back, and let's take you to Jigawa State, where businesses apparently are yet to fully recover since the outbreak of the pandemic in 2020. Secretary to the Association of Small Enterprises said that on the plight of traders, they need more government support. Take a look.
The pandemic has created several challenges for small enterprises in Jigawa State, many of which were still struggling for other reasons, also creating a negative effect on the state's economic activities. Despite numerous interventions, traders in Dutse think that economic activities are yet to fully recover.
COVID-19 pandemic has negatively affected us. We used to buy one basket of tomatoes at the cost of 3,000 naira. But now we have to buy it for 9,000 naira. Life is now very difficult, and we have applied for government support, but we didn't receive it.
Coronavirus has hurt our businesses. Up to now, we're not getting the market like we used to before the pandemic. We also didn't get government support despite applying.
The secretary of the Association of Small Enterprises, Mr. Dallami Shaibu, says more government intervention is still needed to support businesses in Jigawa State.
Shop, factories, industry, and many things closed. So at that time, no movement, no business, no anything. Our business by then was totally collapsed.
It has been shown that small and medium enterprises bring a major boost to the economy. It is therefore in the interest of all that they thrive in the state. Sadiq Ilyasu, Channels Television News.
Away from Nigeria, South Africa's President Cyril Ramaphosa and South African-born health technologies billionaire Dr. Patrick Soon-Shiong have unveiled a vaccine manufacturing campus in Cape Town. Speaking at the launch of the Nansa biopharmaceutical production hub, President Ramaphosa said that if Africa wants to safeguard the health of the people, there's a need to have the means, the technology and the resources to produce vaccines and treatments for all the diseases that afflict the continent. He says that the Nansa facility will make a vital contribution to the mission, complementing the work already being done by other companies. In the meantime, the Cape Town mayor has written to President Ramaphosa, formally requesting that the government ease lockdown restrictions around gatherings. Mr. Hill Lewis said that this includes two specific requests on the economy. One, the 50% capacity rule for outdoor public facilities like public swimming pools be lifted entirely. He also said that spectators be allowed to return to watch major sporting events. Well, joining us to talk more on this is Professor and Head of the School of Health Systems and Public Health at the University of Pretoria. Of course, he joins us now. Professor Lekon Ayo Yusuf, thank you for joining us on the program.
Thank you for having me.
What's your take on those clamoring for eased restrictions? Do you think it's safe now?
Well, I think it's relatively safer, not necessarily safe, but relatively safer. We've always discussed the adjusted risk strategy. So to the extent that we have almost 40% of the population already vaccinated, the risk of transmission has significantly reduced. On the one hand, and on the other hand, is that the consequence of infection on the health system has also significantly reduced because the Omicron has been associated with lower risk for severe disease, particularly in vaccinated population. So when you put the two together and balance saving lives with saving livelihoods, you would come out with a decision that it's time to ease towards saving livelihoods. And I think it's an incentive for people to also continue to obey the non-pharmaceutical intervention in order to continue their livelihoods.
So would you say that that data, less risk, more transmissibility, less risk, is quite a solid data, and perhaps we're moving now to a less worrying aspect of the pandemic?
I need to put a caveat to that. The situation might be different in different countries. So in South Africa in particular, there's a couple of reasons why we might be having a less severe effect of Omicron. One of those is the fact that more people might have been infected before the Omicron than we had assumed. If you remember, the herd immunity was an assumption that you need at least 67 to about 70% of the population vaccinated. So if you have a lot of people who were already infected and developed immunity, it is likely an explanation in our context why the Omicron has not been associated with very severe disease. It might be a different take in other jurisdictions. So a combination of almost 40% fully vaccinated with a large number that might have been exposed not knowing, because studies have shown that a larger number of South Africans had been exposed to the COVID virus. And the combination together is what we are seeing as a less severe effect of Omicron.
All right, with that analysis, the director of Africa Centers for Disease Control, Dr. Nkega Song, said he's encouraged by the way South Africa handled its the latest wave, adding that severe lockdowns were no longer a tool to contain the virus in the long run. Do you agree?
I agree. We've always talked about living with the virus. And I think the practical meaning of living with the virus is that we're going to be having infections. So it does not help to keep counting the number of infections. What it matters is at the time of infection, how much severity, the effect on the health system, and in terms of hospitalization and death. Once that is taken away, counting the infection does not help. Today, Sweden has already announced that you do not even need a COVID test when you arrive in Sweden. So we're getting to begin to live with the infection just the way we live with the flu.
Diseases. We appreciate your time always on the program. Thank you so much, Professor Lekon Ayo Yusuf, Professor, Head of School, Health Systems and Public Health at the University of Pretoria. Thanks for joining us.
Thank you very much for having me.
And British Prime Minister Boris Johnson today announced a lifting of COVID-19 measures across the country. He made the announcement in Parliament today, where he had been under fire for attending a party in May 2020 while the country was under lockdown. He has since apologised for the misjudgment and said the MP should wait for the results of an inquiry. Here's more on the global COVID-19 update.
We now come to the Prime Minister's COVID-19 statement.
Betting Omicron cases have peaked. British Prime Minister Boris Johnson has announced the end of COVID-19 measures introduced to curb the rapid spread of the variant in England.
As a result, from the start of Thursday next week, mandatory certification will end. Organisations can, of course, choose to use the NHS COVID pass voluntarily, but we will end the compulsory use of COVID status certification in England. From now on, the government is no longer asking people to work from home. And people should now speak to their employers about arrangements for returning to the office. And having looked at the data carefully, the Cabinet concluded that once regulations lapse, the government will no longer mandate the wearing of face masks anywhere.
Britain was the first country to limit international travel over the Omicron variant, raising alarm bells about its mutations, and in December introduced work-at-home advice, more mask wearing and vaccine passes to slow its spread. Austria's new daily coronavirus infections have shattered the previous record as the extremely contagious Omicron variant continues to spread. The previous record for new daily cases published by the Interior and Health Ministries was at 17,006, set a week ago. Despite having set a new record, the Prime Minister assures people that the cause of the spread is following predictions. France registered 464,769 new COVID-19 infections over the previous 24 hours, the highest ever recorded tally since the start of the pandemic. The high numbers are explained by the Omicron variant's rapid spread. Scientific data shows a lower risk of severe disease from Omicron compared to the Delta variant. The number of people in intensive care units slightly decreased in the same period to around 3,900. Japan has widened COVID-19 curbs to the capital Tokyo and a dozen regions covering half the population as the Omicron variant of coronavirus drove record new infections. Already in effect in 3 regions, the measures are set to run from Friday until February the 13th. The quasi-emergency measures permit governors to limit mobility and business activities by shortening the operating hours of bars and restaurants and barring sales of alcohol. China has reported the lowest daily count of local confirmed COVID-19 infections in 2 weeks after cities sealed up areas of virus risk, quarantined infections, and conducted mass testing. Mainland China reported a total of 55 domestically transmitted infections, with confirmed symptoms lower than 127 a day earlier and marking the fewest since January the 4th.
Our website, channelstv.com, has more updates, also a better understanding of the pandemic and other news, breaking news at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.